It seems like my patients go through multiple IVs. If we're giving them runs of potassium, I try to Y-site them with saline. Now, there's a thing called glycocalyx protein that we're not paying attention to. Glycocalyx protein is this gel-like substance that is negatively charged. Our potassium ions that we infuse are positively charged. So when those positively charged ions interact and bind with our negatively charged glycocalyx protein, it starts to degrade the functionality and even the mesh of the glycocalyx protein. When it destabilizes, or the lack of negative charge is going to prevent the repelling of these proteins, inflammation markers of these thrombosis clotting factors. And so we are not allowing or inactivating the protective function of glycocalyx protein, if not just purely eroding it with our flushing mechanically and even with the binding of these positively charged ions. So when the glycocalyx protein is gone or ineffective, the potassium starts to touch the walls of the endothelium, the cells themselves, and it starts to cause clotting, thrombophlebitis, and at high enough concentrations, even cytotoxic effects. It becomes cytotoxic. And so this is why your pharmacy only lets you infuse 30 MEQs or less, depending on the patient's complaint of pain, because after 30 or more than 30 MEQs, it becomes a vesicant, and we need to be running those through a central line. Why not through PIV? Who cares? We run vancomycin's a vesicant. We run through those through PIV. So why are we running? Why do we have to run? Ask your pharmacist, hey, your 50 MEQs, can I run that through a PIV? And then ask them, hey, can I run vanc through a PIV? Tell me which one they're going to say, hell no, you need a central line to. The potassium or the vanc? Why? Why is that potassium so dangerous? Why is that potassium highly recommended for central lines? Because it doesn't do good things to our veins at concentrations like that. So this is why your dilution helps reduce the pain, because it's less potassium ions at that concentration causing problems and causing thrombophlebitis at that IV site. And that's why your IVs are going bad. You are clotting because the potassium has gotten to the cells of the tunica intima and then causes these thrombophlebitis events.